that kind of came off weird, and so I'm like, what kind of students am I speaking to today? And she's like, well, they're smart and they're funny. And so that makes me really excited to speak to you today. And so I'll start by just addressing the obvious kind of the question that everybody has on their mind. And that's, how do you grow a mustache like that? And I don't know. So I am a paraplegic. I fractured my C5 vertebrae. I'm about Jessica's age, and so I grew up in a really small town. I come from a ranching background. I grew up, I went to Snow College. I was going to school there and to UVU, working on my degree. And in high school, I started out ranching by purchasing 5 heifers and have been growing my herd since then personally. And in about 2022, I had the opportunity to purchase one of our neighbors' farms, and so I've started off my career doing what I love there. And I was going to school. The farm came with a little farmhouse, and I was fixing it up, getting rid of the green shack carpet and the popcorn ceiling, which was terrible. And one day, Dad has his cows that run on the Forest Service above our small town, and we went up to ride with a group of the other cattlemen that we run cows with. And we had a friend that wanted us to ride a couple of her horses. Now, these horses were actually Mustangs from one of the reservations, and so we both decided to give these guys one last ride before we turned them back to our neighbor, our friend. And we were riding, and we were on our way back to the horse trailers after herding some cows. And the horse that I was on was kicking the other horses in our group, and so I decided to ride it away from everybody. And then as I was coming back to the trail with everybody, it started to take off down the mountain with me, and we were kind of just going all the way to the Muddy River, and it stopped really hard and fast, and I went over the front, and before I knew it, I didn't know what happened, and I found myself laying there and not able to move my arms or legs. And so miraculously, we were riding with a big group, and the other miraculous thing was not 2 miles away, there were 2 search and rescue people on the remote mountain repairing trails. And so they were able to just come right over, and they were able to satellite phone live flight because we weren't near any roads or anything. And so we sat there for what seemed like forever, and then got into the helicopter, and we took off, and I got motion sick on my way to the hospital here. And we landed and got in, and I remember I was laying there. This is kind of a funny story. So laying there, the one doctor comes in after the MRI, and he's like, this doesn't look very good. And then another doctor, now a few weeks before this, I had been tubing down our local creek, and I am a rancher, so I don't wear shorts. And so we were tubing down this creek, and I didn't put any sunscreen on my legs, and so my legs were red as a lobster, and they'd been peeling. And so when they pulled the pants off and I'm just laying there, the doctor walks in and he's like, what happened to you? Because my legs just look like I have leprosy. And I'm just laying there and I can't move. And he's like, that's a different issue. Don't worry about that. So I was in the last thing that I remember right then was they were going to put me into traction, and they put the injections in my head, and they started cranking the screws in, and the numbing doesn't really work on your bones, especially in your skull. So after that, luckily, I don't remember a lot about the next few days. I was on a breathing tube. I was having a hard time and started coming to, and I got pneumonia a lot from my lungs, and we kind of had a hard time there. Moved to after a month in the ICU there, we moved up to the U and worked with their spinal specialists there, and we did a lot of physical therapy. I was on a ventilator there too. I got off of it, and then later on we moved to Central Valley Medical Center, where Jessica's dad works as a wound specialist there, and was able to get me into there. And I kind of I recovered pretty well there, and then now I go to outpatient physical therapy at a place called NeuroWorks up in Sandy, which specializes there. And we live past the windmills, clear down to the middle of nowhere, and so we drive 2.5 hours once a week, and we go and get good physical therapy there while we can get it. That's very specialized, and that's kind of where I'm at now. I'll kind of go through kind of the day in the life, typically what my day looks like while I'm at home. So I wake up, and during the night, I'm a side sleeper, so I lay on one side, and then to avoid bed sores, I flip over once in the night, and then I wake up, and then Dad or sometimes my mom will come in, and they'll flip me back over, and we'll perform bowel care for about an hour and a half, depending on the day. And I don't cath. I have a suprapubic tube, which is just a tube that goes straight to my bladder below my waistline. And so we've avoided a lot of UTIs since I've had that. I was 11 out of 12 weeks I was having UTIs, so that was a huge thing, huge life changer. So we empty the pee bag, and then then Dad will dress me, which takes a little bit because I deal with a lot of spasticity, and so Dad wrestles my legs to put my pants on, and then we get in. He transfers me manually into this chair, and then we'll go to the sink in my mudroom, and we'll wash my hair, and then after that we'll eat breakfast. I have a special scoop plate with a tall side on the side of it, and then I put a cuff on my hand that has a little slip for utensils or pens, and I can put that in with a bent fork, and I can feed myself. Okay, I have to have a check pad on, but I make a little bit of a mess. So then the rest of the day, will either run errands, or I'm working on building stamina to push a manual wheelchair that has power assist hubs in it. I also have a standing frame at home, so it does a lot of good things for my body, because you're not meant to sit around all the time. So bone density, joints, even some of my bowel function is improved by that. And then I also have a track wheelchair, because I'm a rancher, that was donated to me, that I get in most days, and I go check on the cows out behind my house. So I've been fortunate to keep my farm and be able to go out and check on those and look at other things, and we go on lots of adventures all the time. And so, yeah, what is it that I as a professional patient, want you to know today. I'm gonna be really honest with you all. I don't really care or worry about your technical training. Why do I say that? I'm going to tell you a little bit of a story. So when I went to one hospital in the ICU, they were worried about my fingers tightening up. And so what they would do, and it was a multi-million-dollar hospital, they get a tissue box, and they're trying to wrap my fingers around it and then wrap gauze around it so that my fingers don't get tied. Then we went to another hospital, and they said, no, that's totally wrong. We want your fingers to be tied to use what's called tenodesis grip so that you can use the tension in your fingers, because I don't have function in my fingers to be able to pick stuff up. And so you have two hospitals that are saying totally different things. Also, how fast do you think things are going to change throughout your whole career? We're all, Jessica and I talked about this, we think we're old, but we're actually not that old. And so we all have long careers ahead of us, and we're in a time of extreme changes that it's probably going to look completely different, maybe even in the next decade, from treatments to philosophies. And so AI, regeneration, I think it's going to change. I think Dr. Dale Hull at the NeuroWorks facility that he's the co-founder of, I think he said this, what I'm trying to think of best. He said that, well, so Dad, while I was in the hospital, went on a tour of that facility. And Dale is a walking quadriplegic. And so Dad shows up at the facility, and they walk around and look at all of the fancy equipment, all of the state-of-the-art walkers and harnesses on rails and multi-million-dollar pieces of equipment. But he said, people heal people. And then he also said, once we first got there, that I built this facility for you. So I'm going to give you two examples of how this might look. So they're from the same hospital. None of us know who they are, and that's why I picked these examples, because there's so many other examples of the good and bad. But while I was doing therapy, inpatient therapy, one of the therapists pulled my dad aside, and he said, look, this doesn't look very good. It's been a few months. You're probably not going to see much more improvement. You should probably just hunker down and prepare yourself for a long, hard life if he survives at all. Now, you gotta keep in mind that at this time, I was still on a ventilator. I was still barely able to run the joystick on my chair. I was passing out every half hour because I struggle with blood pressure, and getting UTIs and cathing all the time. And so we're going to remember that interaction for a long, long time. Now I'm going to tell you an example of another lady, who had the exact number of years of experience, same as the other guy, 20 or 30 years. And this lady, I don't think we ever had a serious conversation in the world. So I developed a stage 4 pressure wound on my tailbone. So the bone was sticking out by this time, and she was the wound care specialist. And she would come in, and she would work on it, and she would, every day, she would treat it, she'd put the gauze in, she'd put the Band-Aid on, and then she would draw a frog or a butterfly or anything on that she wanted to, because I wasn't going to be able to do anything about it. and so I have this kind of personality where I sort of get things stuck in my head and kind of obsess over things, like especially when bones are sticking out of my body. And so I'm every day I'm asking her, okay, how does this look? How is it getting any better? And you know, she just was behind me, and she's listening to me every day fret about this, and she's like, I don't know, I think we're gonna need to get some maggots for this. Maggots? What? And she comes around and she has this look on her face, and she is smiling so big. She's so passionate about these maggots. She's like, they are the coolest thing ever. They eat only dead flesh. Their saliva is antibacterial, and their feces are antibacterial. I'm like, that's cool. and then she said, look, Thomas, I am doing everything I can to help you heal from this. Because at the time we're talking about skin grafts, and now she's mentioning maggots, and she's like, I am looking up everything I can to help you heal this over. And I'm not above looking into things or pursuing things that may not necessarily be medically proven yet. So I'm going to do everything I can. What I want you to do, and she's so silly, she's like, I want you to send some love down there all the time, every chance you get. Just think about sending some love down there. And I was like, okay, all right. And then I just mentioned in passing, like, okay, mind over maggots. And she's like, mind over maggots. And that became our slogan every day, mind over maggots, mind over maggots. And so, you know, it took a little while, and I left there and I went to Central Valley Medical Center, where Jessica's dad is an exceptional wound care specialist. And we got there, and he looked at it, and I told John, I'm like, John, this crazy lady at this hospital is like, she was gonna put maggots on this. And he's like, and he just lights up, and he's like, maggots are so cool. Their saliva is antibacterial. So wound care specialists are great. They're freaks. They're great. So you have those two experiences as a patient. Now, I want to ask you, if you have a problem or you have a symptom, which person are you going to go and tell about that? So you have all of these different things out there. How about early detection? Are people avoiding going to the doctor because they have a symptom, but they don't know if they really want to speak to somebody about it? What about the widower effect? Has anybody heard of the widower effect? Where after a man's wife dies, his life expectancy goes way down because his wife isn't nagging him to go to the doctor? What about placebo? I mean, you guys have all heard of the placebo effect. I don't need to go into that. But are you going to just dismiss placebo at all? Or are you going to at least encourage it, even though maybe it's not within your control? So why do patients come to see you? It's because you are interested in them getting better, because everything else is probably going to change within our lifetime. But they're coming to see you because you are interested in them getting better, and you are here, and throughout the rest of your career, you are doing everything you can to be prepared to do that for them. And I think if you can do that, you will have a long, fulfilling, successful career. So thank you very much. And I'll open it up to questions if you guys have any.
I just want you to share some of the opportunities you've had that you didn't think you would have had otherwise since you've been in your chair.
Okay, so where do I begin? So I went through a group of, well, it was actually our neighbor who set it up. A year after my accident in October, so that would have been last year, excuse me, I went on an elk hunt. So it was kind of new for everybody, because how are we going to get up into the mountains? How are we going to set up our seats or set up and shoot? Because my trigger finger isn't all that great. So we set up a tripod with a gun and a little tripod thing that I could look through the camera of the phone through the scope and pull the trigger, and we spent all day looking for elk, and we saw a bunch, but we had a few misses, and we kind of had a hard time, and all of a sudden we're just sitting there, and an elk comes across and sets up right in front of the crosshairs, and we adjust a little bit, and we didn't let it get away, and we shot, and it died in the road for us, which was great. And so that was an amazing experience that took a lot of work and a lot of figuring out, but I did that. That was really incredible and a lot of work for everybody. So now in my little house in my living room, I've got a great big elk that sits on a stand that kind of takes up the room, but it's a conversation piece. So yeah. Any other questions? Yeah.
I don't think you touched on this, but throughout your care and your whole experience, have you worked with many PAs? And if you have, what stood out to you about them?
A lot of PAs like that will meet regularly, often to just renew prescriptions, do annual checkups, and so my experience is that a lot of them have been really great and exceptional, and we love to see them, and a lot of them we can just call up on the phone and just, if we have a question, because sometimes it's a bit far for us to drive, but we can usually dial them up, and they're our friends, and we can talk to them and get things taken care of if we have any questions. So being able to kind of have that other kind of relationship that isn't just professional, but is more what more like peers has been really beneficial for us, especially in a rural setting and where I have such extreme conditions. So, yeah.
I would have a really hard time in a situation like yours, so I'm wondering what you do from a mental perspective, or for anyone that suffers from a chronic illness or condition, what you would recommend to stay healthy mentally.
Yeah. So, for me, getting outside is really important for me. So, especially my track chair has been one of the biggest differences for me, being able to get out in nature, and especially like removing myself from like a medical environment that sort of is more or less distracting from the condition, and placing my focus on other things rather than myself inwardly is much more helpful for me than just talk therapy or something like that. So, which talk therapy is really important, and I have a lot of friends and family that I can speak with about challenging things if I'm having a hard time, but they're really good at just listening and just kind of being there. Sometimes you don't have a good thing to say to people, but if you're trying to help them, sometimes just being there, just sitting with them. There was the other day, so my state presidency is silly, and they put me in a calling to go to our local nursing home. And so, we went to see this woman who was really upset because she had liver problems, and she was in a lot of pain. And, when you're just sitting in a hospital room, and most of the time you're by yourself because nurses might be busy taking care of other patients, we kind of went in, we gave her a priesthood blessing, and then she was still pretty upset, and so I decided to just stay there along with another lady, and we just sat there and talked to her, and I told her about all of my silly adventures out on the farm and the range and in track chairs. And it's amazing how just a half hour of talking to somebody and removing them mentally from the situation, even just for a little bit, can make a lot of difference. And by the end, she was smiling and laughing, and we had a good time and made a good time of it. So hopefully that answers your question a little. Any other questions? Yeah.
I'm wondering what we can do as people in general to improve accessibility, but also as like healthcare providers, how we can improve accessibility to healthcare.
Yeah. So, I mean, hospitals and medical places, they tend to do a lot better job than in the private sector. So sometimes, like, I'm a really good wheelchair operator, but even like some of those exam rooms are really tight, especially if you have other people trying to sit in there. So just trying to think through, okay, they may not be able to fit in this room, or we might have to move some chairs. Other things like I have a hard time opening doors, like I really can't. So being mindful that if you don't have automatic doors, you may have to help open it and hold it open for me, or and then in the private sector, stairs are a hard thing. So thinking about, can I, is there a ramp? Is the door maybe wide enough? Just some of those different things. Another thing, with these power chairs, they're super heavy, and this joystick is really sensitive. So if you're trying to, touch somebody or reach or exam, be really careful with that because I tried to kill Dale Hull with my chair. He went to show me his electric vest because I have a hard time regulating my temperature because I think it's because the pores don't open and close in my skin to retain heat. So he was showing me his vest and he went to flip it onto my lap and grabbed this joystick. We started going forward and I pushed him into the wall of his office, and luckily he was okay, and he fell backwards, and he said his back felt better after doing it. So I tried to send him a bill, but it could have been a lot worse. So being mindful, just like should we shut off the chair before we do this? Some of those kind of things that can make it smoother and not so awkward for people. So yeah.
What's your favorite thing to do?
My favorite thing to do, it's probably going out in my track chair to look at my cows and I'm thinking about cross fences and water troughs and thinking about ranch improvements. I like going out for drives, going out and seeing things. We take my wheelchair van places that you probably shouldn't go, but we take it there. Dad will load me in the pickup truck, and we'll go into the mountains and look at the cows there. We're going to go this weekend and go see if we can spot anything, and so just anything outside. Also, I like visiting with my friends. I have a lot of cousins that I speak to that we're good friends, and we talk about things and life, and just being as regular as possible is one of my favorite things. Yeah.
How many cows do you have?
So I have 25 cows, and most of them have babies, and then 1.5 bulls, which is complicated, but I have half interest in the bulls, so yeah. And Dad has about 100 cows, so I have about 60 acres of irrigated hay fields and pasture on my own, and then my cows are on a private ranch that they can graze on a lot of the year, throughout the year. So yeah, I'm trying to build up more and think about how to expand and how to get automatic gates to open so I can get through gates, and we've got a skid loader that we're trying to adapt so that I can just drive it with my hands because it just has 2 joysticks that don't require feet, and so we're working on that. The challenge right now is that I've gained a little bit of weight since I lost so much weight, so I'm a bit harder to transfer up into vehicles. So we're kind of inventing the wheel a little bit, trying to figure out how to get me into a piece of equipment. So yeah, always trying to find new things. So thank you.
I'm curious if you have, I mean, you've given us a lot of great advice and things to think about, but as we interact with patients and make friends with people who have similar life experiences to you, what is one thing you want us to keep in mind?
I mean, I guess maybe my personality is unique to me too. But like, okay, so here's an example. So every month I have to change out my suprapubic tube, and there's one nurse that talks to me like I'm either 9 years old or 90 years old. And so you know, like us, I would say, like, especially, you know, when you look at somebody in a chair like this, you know, I would err on assuming that there's competence there, and then interacting like just a regular person, just like you would another nurse, as opposed to, you know, and maybe like a kid would appreciate being treated like a kid, and a 90-year-old would like to be a 90-year-old. So I think, you know, it is a little bit of a dance, but it's like interacting with people in general, you know. So keeping that in mind and, you know, asking relevant questions, you know, like there's going to be things that you don't know, so you have to ask about them, and you you just have to think about, you know, not being offensive, but also trying to gain more information. And you don't know what you don't know, so it's also incumbent on people like me to explain, you know, I can't lean myself forward, or I need a little bit of help with this, or I may, you know, if you sit me up a certain way, I might fall over. So you kind of have to become a sort of a teammate with your patient to try to care for them the best. So, yeah.
Kind of along those same lines, have you noticed that there's any words or phrases that are commonly used by your healthcare providers that maybe you don't appreciate or you wish they would use different terminology or different wording?
For me, no. Like, I call myself a cripple all the time. So it's like, I think it just depends on the person. And so, no, I like to be treated as normally as possible. And I don't mind if people are truthful with me, or I don't get bogged down by certain terminology. So, yeah.
Similar to that as well, but do you encounter any like stigmas or myths often that you wish weren't a thing?
I think generally, I this okay. So this is kind of funny. So I have a therapist who I work with at physical therapy. I kind of rotate between therapists, so I don't get this necessarily the same one every time. So I'm telling this therapist about some of the things I'm doing and trying to do, and she's like, I gotta be honest, Thomas, most people with your level of injury stop doing things. They don't go back to work. They don't, you know, they kind of just become a full-time patient, and they, you know, I've been very fortunate to have family and friends that can help me, you know, stay in my own house and be able to do things. And so, but sometimes I think there's an assumption that we're not doing things, or we're not continuing to live. But, you know, I'm far enough in now that a lot of the things that I'm dealing with are just normal every day, and I'm kind of at the same state of mind that I was before my accident. So now it's just moving forward, and how do we make certain things more possible, as opposed to people, you know, assuming that maybe you shouldn't do certain things, or just kind of that mindset, a mindset that I probably would have had before my accident also. But I've been very fortunate to have people that have encouraged me to move forward in life. So I think just kind of just finding ways to make life possible. So, thank you. Yeah.
What's the biggest perspective shift or piece of wisdom you've gained since your accident?
If you're a jerk before your accident, you're going to be a jerk after your accident. So just because somebody goes through a hard thing like this doesn't mean that they're a saint. And sometimes people will look at me like a sage or something, and it's like I'm really just a guy in a chair. So actually, the wisdom is that sometimes the wisdom doesn't necessarily just come after the accident. So, yeah. Yeah.
I was wondering if there's any like devices or any like medical technologies that maybe are almost open to the world but not quite yet that you're really excited about?
So, yeah, there's a couple. So, I just filled out a survey with the University of Utah. They're trying to develop a piece of equipment that is kind of like a claw crane that hooks onto your chair, and then you can use either sip and puff or a joystick or even a brain implant to control a claw to do like open a door or open a can of soda or take a drink with. So that's something really cool. There's another, what? I had it in my head. Exoskeletons. So, it kind of hooks onto you and then it'll stand you up and walk you around. So even though you're not doing it, you can still stand and move around and get up. And there's another group in Israel right now that is actually trying to regrow sections of spinal cord, and they've just implanted into I think a dozen patients now, and so far they're seeing some pretty promising results. So I wonder that if in my lifetime I may get it back on my feet again. So yeah, really encouraging, but we're trying to make do in the meantime. So yeah.
Sorry, one more. Do you have a pick for the Holy War this weekend?
I saw a billboard for that, and I don't really know what it is. So
You said BYU earlier. Like, go BYU. The
Oh.
Holy War, like Utes versus BYU.
Oh, yes. That's a good question, because I went to UVU, so I'm kind of in between. That's the answer? Are you guys, what are you guys?
Go ahead and finish.
Well, I'll finish with this. I appreciate you guys listening to me, and I hope could be a little bit of a service to you to kind of provide some perspective a little bit. And there's so much more that I could cover, but in the time that we had, I wanted to let you know the very most important thing that I want you to know, and that's to make sure that you care about people, and the rest I think will fall into place because you're doing so much hard work here. So thank you so much for having me.
So when I asked Thomas to come speak, I said, firstly, what is a piece of advice that you have for us as medical professionals? And right off the bat, he was like, make sure you have good breath. So everyone pop in a mint or gum if you're gonna interact closely with a patient. So, thank you, Thomas, for coming. Thanks, guys.